Welcoming Dr. David Klein of the Stages of Life to the program right now. And what we're going to talk about today is ED and heart disease. Now, the normal person would say, what's that got to do with any of this? But this is serious stuff.
Well, this is going to get your attention, and unfortunately, it may get your attention real hard and real fast. Okay, here's how it works. So you think your hydraulics are the issue, and you think that the nitric oxide that's being released by the cells in what are called the PDE5 receptors, that's the problem. You're going to think that maybe it's the diabetes that's the problem. You're going to think lots of different thoughts, but I'm going to tell you what the real problem is. The real problem goes something like this. If you have erectile dysfunction, if you have ED, okay, and if you have ED for, let's say, I don't know, for any length of time, a year or two or three, and you've never had a heart attack before, you run a 15% chance of developing a heart attack sometime in the next 7 years. That's enormously important, okay?
Oh.
So guess what, okay? You know that portion of your anatomy isn't doing exactly what it's supposed to do. And if you focus on testosterone, if you focus on the wrong things, you're going to end up in the wrong end of an intensive care unit if you're lucky. You know, the presenting symptom of heart disease, half of the time, is sudden death. This is not a joke at this point. People drop off all of the time with this. And right now, testosterone therapy is starting to get a bad rep because people are dropping dead. Well, here's the issue. It may not be the testosterone at all. In fact, the statistics show that testosterone therapy decreases your risk of cancer, decreases your risk of heart disease, decreases lots of risks. Unfortunately, if you don't take care of the underlying problem, it's going to get up and bite you. And one chance in six is a pretty big one. 15%, one chance in six. That sounds like a lot in over a 7-year period.
Yeah.
Look around at the folks you're playing poker with. One of you ain't going to be here. So what do we do? How do we handle this? Okay, you need to talk to your doctor rather urgently about this sort of thing. And the fact is your doc may not be aware of the statistics.
True.
You have to be. Okay, it works like this. The docs are having to do more and more for less and less. That's a fact, is what it is. The second thing is the better docs. Many of them, most of them, pretty soon all of them maybe, are going to leave practice out of frustration. This is going to leave folks, let's say, with secondary credentials, things that aren't all that great. They may not have gone to, let's say, high school in this country, let alone medical school, let alone residency in this country, but the board doesn't really care. They need to put people in offices in this state just to make sure that you get your flu shot, just to make sure that you get the basics. And it might work for that, but it doesn't mean that you're dealing with high-quality membership of the community, if you get my drift. You have got to be on top of this. You have got to be out front, and you've got to steer your own bus on this. And it works a little something like this. How do you screen yourself for cardiac disease? Well, there's certain questions you're going to ask. Well, gee, my chest doesn't hurt. I don't get those numb feelings down my arm. Okay, erectile dysfunction is one of the early symptoms of vascular disease. There are tests that you can do to sort through some of this. So you can do something as let's say, as unspecific and insensitive as an ABI. We do these in the office all the time, non-invasive ultrasound, but you're looking at the peripheral arteries. Okay, it's a soft indicator of cardiac disease. You can do these radiologic studies, which are very, very good. Okay, but they can be a little bit pricey. There's a very fine doctor out in Lake County that does these as a matter of routine. You're looking at the coronary arteries. Do you need to go in and get an angiogram every time somebody comes in with ED? And the answer is no. We'd be doing far too many angiograms with its own inherent risk. But there are things that you need to be doing proactively. One, you need to be seen by your physician. You need to be seen regularly. An annual EKG may be life-saving in these circumstances.
Whoa.
What's it going to show? It'll show a change. Very few of them are perfect. If you look in the mirror, you're not going to see perfection. Okay? Perfection is not for us. There are always abnormalities. What you're looking for is change. Change over a 6-month period, change over a 12-month period. And EKG is cheap. There are doctors out there that offer, well, if you join my X, Y, and Z concierge, we'll do free EKGs. My God, the things take 5 minutes, cost nothing to do. We charge, I think, $25 or $30 to do them in the office. They're nothing, okay, if not a high yield kind of a test with regards to looking for changes in your cardiac function. If you have ED, this particular study should be done at least annually, if not every 6 months, looking for change. This is something you need to ask your family doctor to do. And if your insurance doesn't cover it, pay for it, for God's sake. They don't pay, hey, if you came down from Michigan, did your insurance pay for your snow tires? Okay, probably not. Okay, that's just the way that these things work. Get used to paying for things that you need to get done. What else do you need to do? There are screening studies in terms of blood work that should be done annually. One called a CRP, something I've been doing for 20 years or more. And what this does is it's a soft indicator for increased coronary artery risk of death. Okay, what does this study cost? About $20. It's blood work.
Wow.
You draw your blood, you have it done. Do you need to do more? And the answer is yes. Homocysteine levels, very, very important. They too are associated with increased coronary artery disease. But there's more. What else do you need to look for? Okay, those are the basics. That's the tinker toy stuff. That's the stuff that even your family doc can probably figure out in short order. What else do you need to look for? Insulin to glucose ratio, something called metabolic syndrome, also associated with ED and increased coronary artery risk. So the ratio of insulin to glucose is very, very important. Your glucose level may be very, very normal at 23 or 24, but it's sick. You are sick if your insulin is much over 10, 15 max. Okay, yeah, the ratio is kind of sort of right, but kind of sort of can sometimes put you in a pine box.
Ooh.
So what else do we want to look for? And this is the fun one. We're going to discuss this on another show in greater depth. Okay, and that's your thyroid. Hypothyroidism, subclinical hypothyroidism can lead to early cardiac death.
Whoa.
Think this one through for just a second. Okay, now, the specialty societies thought that TSH, thyroid stimulating hormone, the gold standard in determining thyroid function, was abnormal if it was over 8. Then came the big oops moment, and they dropped it to 7. And then they came up with the oh crap moment, and dropped it to 6, then to 5, then to 4. Now it's in the 3s, soon to be in the 2s. Now, somewhere along the line, our specialists may not be so special, but for perhaps in a very, very different kind of way. Special ed, maybe. Okay, so it works a little something like this. Thyroid stimulating hormone may not be the gold standard after all. Why is that?
Whoa.
Let's think this through for a second. What it does is it measures T4 feedback loop to the pituitary. But the real hormone is actually T3. One person in 6 can't convert T4 to T3 worth a darn. And then even more interestingly, the studies are coming down now looking at something called T2. Now, T2 is interesting, okay? T2 may actually be the most important of all these hormones with regards to thyroid function and anti-aging medicine. Now, is there a study that you can do looking at T2? And the answer is not yet. Okay, I've got to go talk to my technical guys to see if we can't start pulling this thing down on the mass spec, because I want to study this one. Okay, what are your serum T2 levels doing? T2, very, very important, and nobody knows anything much about T1 at this point. So the take-home message is this. If you suffer, let's say that the wind is not in your sheets anymore, your sails have now fallen, okay? Don't think so much about the old lady. Think a little bit more about your heart, okay? Because somebody else may be taking care of your old lady before it's all said and done, okay? 1 person in 6, really 6.5, is going to die of a heart attack in the next 7 years in those individuals that haven't already had a heart attack. If you have, guess what? The stats are even greater. Whoa. Now, what are the implications with regards to the insurance companies? Now, this data is very, very new, okay? If you need Viagra, if you need Cialis and Levitra, and you are the life insurance company, what would you do to that person's rates?
I think I'd skyrocket them.
I think that's probably what's going to happen. The economic implications of this is probably going to be in life insurance premiums and in disability premiums. So be very, very careful as you're going to get those little blue pills, because you may well have shot yourself in the foot.
Because as we discussed last week on the show, now with the Affordable Care Act, all the medical knowledge is right to the insurance companies immediately.
And it has been since 2008. So if you think you're off the grid, not so much. All that free stuff that we were promised, guess what? It wasn't free. In fact, there wasn't any stuff to get, but there was tremendous cost in the unkept promises. There's tremendous cost, and you need to take control of this.
But there is something free, doctor, and that's a trip to the stages of life. Well, you might have to put a little gas in the tank, but that's not bad at 209.
It's
Robin?
not. Our phone number is 407-679-3337. We are located conveniently in Longwood, right off of I-4 and 434. Our address is 1917 Booth Circle. Office hours are Monday through Thursday, 8 to 5. The health store is open during office hours, so come on in. And you can also find us on the web at stagesoflife.net and Facebook, Stages of Life Medical Institute.